How many grafts are required? That is a very common question which patients ask. Hi, I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. And today I will help you understand your graft requirements in two special cases. So we will discuss these two patients. This is the first one. He is a famous singer, Rohit Chauhan. You can Google about him. He wanted a really young hairline, what I call a designer hairline, something like Tom Cruise hairline. So we transplanted 3000 grafts for him. And as you can see, he is very happy with the result also. Now what do you have to see in the result? That the result is looking absolutely natural and the patient has got the hairline and the look that he wanted, not a compromise. Now we come to this second case. This is a French patient. He has also a similar level of hair loss, a bit more in towards the vertex, and he wanted a dense young hairline and he should be able to spike his hair. So as you can see in the result, we have been able to do that. We transplanted 4200 grafts at a high density to do this. So do not keep on asking doctors how many grafts I need. Ask them first how many grafts have I lost, or understand how many grafts you have lost, and then think carefully of the final hairline that you want, because your hairline will become your personality. Everyone will recognize you by your hairline, and the technology has advanced in hands of some doctors in the world, not everyone, so that we can provide you such young hairlines. You have to understand this thing. Not every hair transplant clinic or doctor has the most advanced technologies. There is a learning curve, an experience curve. Once you enter this field, most of the doctors can barely do 2,000 to 3,000 grafts. It takes years to reach 5,000 grafts in a single patient. And of course, almost a decade to reach 10 to 15,000 grafts. We routinely do such procedures. So if you know any friend who is researching and who has hair loss like this, do share this video with him. So in this particular case, we placed 5600 plus graft. It was a large area and patient wanted a young hairline. So that is what we gave at a high density. Why did we place 5600 plus grafts for a person who is barely Norwood 5? Because he had lost at least 15,000 nature given grafts. The full head contains 40,000 grafts. And if you look at his picture, you can easily make out that he has lost at least 35% to maybe 40%. So that is a large number of grafts. That means he has lost around 14,000 to 16,000 grafts. And we have to replace them. So we replaced it with a minimum of 5,600 grafts. It's not a large number. So if anyone tells you that we can do it in 3,000 grafts, remember, either you will have to settle for a high hairline or a low density. If you have any friends who are in a similar situation, do share this video with them. If you have any particular hair loss situation which you want me to talk about, do let me know. I'll be giving a series of these videos on different levels of hair loss so that I can help you understand how many grafts are really required. You should not be hindered by the fact that your clinic or your doctor does not have the advanced technology to be able to put that many grafts. If you want the best result, you have to choose the best technology and the best technology provider also. And the hallmark of a best technology provider is that we go as close to nature in terms of the number of hair grafts as possible. And now we'll discuss two cases, two examples of a Norwood 5 and a Norwood 6 level of hair loss. Let's first discuss this Norwood 6 level of hair loss patient. Now in him we transplanted 10,000 plus grafts. All grafts were taken by the FUE method and from his scalp and all over his body donor areas. In 5,000 grafts we managed to give him a high hairline. But then he came back for more grafts, and that time we lowered his hairline also and we filled his crown area also. This is another example of a Norwood 6 level of hair loss. In this, we placed almost 8,000 grafts and this covered from the front going all the way to his crown area. A small round patch was left in the crown without transplant. This is the number of grafts you need, even if you want to replace only 50% of the grafts that you have lost. You cannot fill a Norwood 6 patient's head with just 3,000 to 5,000 grafts. So I hope these two examples have helped you understand. Now we talk about Norwood 5 patient. This is one example of a Norwood 5 patient. Here we have transplanted a rounded hairline as per the patient's preference. The hairline is slightly mature, not very young, and we have covered the entire frontal and the vertex area at a high density using 7,000 plus grafts. So these grafts were transplanted at a good density and you can see the result. This one is another case of Norwood 5 level of hair loss. Again, you can see if we transplant at a good density and a large number of grafts, then you can get very pleasing aesthetic outcomes. The results are very good. So if you are wondering how many grafts you need, or if you have a friend who is in such a situation, do share this video with him. And of course, like this video, subscribe to our channel. I'll be giving you a series of these videos with different levels of hair loss. If you have a particular level of hair loss which I have not addressed, you can contact me. I will talk about that level. Thank you.